including the digestive and reproductive systems, meaning that the intestines as well as testes or ovaries are growing. Now that you're 9 weeks pregnant, your little one may be starting to move, thanks to some recent muscle development. But you'll have to wait until sometime in the second trimester to actually feel these movements. The size of the fetus at 9 weeks pregnant. At 9 weeks, the fetus is about the size of a cherry. Your little one may now measure 0.6 to 0.7 inch long and weigh about 0.12 ounce. Mom's body at 9 weeks pregnant. Symptoms at 9 weeks pregnant may include changes to your breasts. They are probably fuller, heavier, and tender to the touch due to the enlargement of your milk glands and an increase in fatty tissue. Although your breasts will likely continue to grow throughout your pregnancy, the sensitivity will usually subside once your body adjusts to the surge of pregnancy hormones. 9 weeks pregnant, your symptoms. At 9 weeks pregnant, here are some of the symptoms you may be experiencing. Growing waistline. Your belly at 9 weeks pregnant may not have a pronounced, rounded look, but your pre-pregnancy clothes are probably feeling a little snug due to a combination of a thickening waistline and some bloating brought on by your old friends, pregnancy hormones. Spotting. You may see some spotting in the first trimester. Call your healthcare provider if you see any more than a few drops of blood. Mild uterine cramping. This is a time of rapid change in your body, and you may experience mild uterine cramping. If the cramping is severe, or if you feel other pain like lower back pain, call your doctor to rule out any problems. Morning sickness. If you haven't experienced morning sickness by now, you could be one of the lucky ones who will avoid this common symptom. But if you do get morning sickness, keep on eating smaller meals frequently throughout the day and remember to stay hydrated. Being hungrier. You may start to feel a bit hungrier than usual, so munch on some extra snacks, keeping in mind that you only need to add about 300 calories to your daily intake. Foods like fruit, cereal, and yogurt are great choices. Food cravings and aversions. Your sense of smell is heightened now, and foods and smells you once enjoyed may now seem unpleasant. On the flip side, you may now find you crave certain foods. You can feel free to indulge any food cravings you have, as long as they seem healthy. Just make sure you're sticking to a balanced diet. Always talk to your healthcare provider if you crave non-food things like dirt or chalk. Fatigue. Thanks to an increase in your levels of the hormone progesterone during the first trimester, you may find yourself sleepier than usual. Rest as much as you can during the day, particularly if you're having trouble sleeping at night. Feeling moody. If you're feeling on top of the world one minute and doomed the next, you can thank pregnancy hormonal changes. Speak to loved ones about how you're feeling. It may help you feel a little better, and seek help from your healthcare provider if your mood swings are severe. Frequent urination. Yes, those extra trips to the bathroom may still be a part of your day as your baby grows and your uterus presses against your bladder. This need to pee more often may also be caused by the increased volume of blood in your body, which makes your kidneys work overtime. Don't drink less water, as staying hydrated is important, but try to go to the restroom before you head out the door or before you go into a long meeting. If you notice a burning sensation or pain when you pass urine, call your doctor, because this can be a sign of a urinary tract infection. Acne. If you're experiencing acne now and didn't before you got pregnant, or if your acne is worse now than before, it may be one of your pregnancy symptoms. Read up on how you can combat some of those spots and blemishes, and remember that it's just one of those pesky pregnancy hormone-related symptoms that should clear soon after your baby is born.
Intro. Hey there, amazing viewers! Welcome back to our channel. Today, we have a topic that's close to the heart: pregnancy and self-care tips. Whether you're expecting, planning to be, or just curious, you're in for a treat. Stick around for the top 15 points that'll make your pregnancy journey a breeze. Point 1. Mindful nutrition. First up, let's talk about nourishing yourself and your little one. Opt for nutrient-rich foods, plenty of fruits and veggies, and don't forget that hydration game. Point 2. Gentle exercises. Next on the list is staying active, but no need for intense workouts. Gentle exercises like prenatal yoga or a simple stroll can do wonders for your well-being. Point 3. Beauty of rest. Ah, the beauty of rest. Embrace those power naps and full night's sleep. Your body and mind will thank you. Trust me. Point 4. Emotional wellness. It's okay to have mixed emotions. Prioritize your emotional well-being, whether through journaling, meditation, or just having heart-to-heart talks. Point 5. Pamper yourself, pamper time, treat yourself to a relaxing bath, a prenatal massage, or whatever makes you feel like the queen you are. Point 6. Support system. Surround yourself with positivity. Your support system is crucial. Friends, family, or fellow mom-to-be pals. Point 7. Educate yourself. Knowledge is power. Educate yourself about the beautiful journey you're on. Attend prenatal classes, read books, and absorb all the information. Point 8. Regular checkups. Speaking of information, regular checkups are a must. Keep track of your and your baby's health with those scheduled visits to your healthcare provider. Point 9. Fashionable comfort. Who says you can't be fashionable and comfortable? Invest in maternity, wear that makes you feel good and accommodates that growing belly. Point 10. Hygiene essentials. Pay extra attention to hygiene. A healthy baby. It's the little things that count. Point 11. Positive affirmations. Daily affirmations are like a power boost for your mindset. Remind yourself of the amazing journey you're on and the incredible mom you're becoming. Point 12. Create memories. Capture those beautiful moments. Whether it's through a pregnancy photo shoot or a simple diary, create memories that'll last a lifetime. Point 13. Delegate tasks. Don't be shy to ask for help. Delegate tasks and focus on what truly matters, your well-being and your baby's. Point 14. Stay flexible. Plans might change, and that's okay. Stay flexible and adapt to the beautiful uncertainties of this journey. Point 15. Celebrate milestones. Last but not least, celebrate the milestones. Every kick, every ultrasound, it's all part of your incredible story. Outro. And there you have it, the top 15 points for a happy and healthy pregnancy. If you enjoyed this video, don't forget to give it a thumbs up, subscribe, and hit that notification bell. Until next time, take care of yourself and that precious bump. Sending lots of love.
30 foods for pregnancy. Hey everyone! Welcome back to the channel. If you're expecting or planning to get pregnant, you're probably wondering, what are the best foods to eat for a healthy pregnancy? Well, you're in the right place. Today, I'm sharing the top 30 foods that are packed with nutrients to support you and your baby. Let's dive in. First up, let's talk about fruits and vegetables. These are essential for vitamins, minerals, and fiber. Here are my top picks. 1. Spinach, loaded with folate, iron, and calcium. 2. Sweet potatoes, rich in beta-carotene, which converts to vitamin A. 3. Avocados, packed with healthy fats, folate, and potassium. 4. Broccoli, a powerhouse of vitamin C, fiber, and calcium. 5. Oranges, great for hydration and vitamin C. 6. Berries, like blueberries and strawberries, full of antioxidants and vitamin C. 7. Bananas, high in potassium and easy on the stomach. 8. Carrots, great for vitamin A and beta-carotene. Next, let's talk about whole grains and legumes. These are amazing for energy and protein. 9. Quinoa, a complete protein with all essential amino acids. 10. Oats, high in fiber and helps with digestion. 11th. Lentils, packed with protein, iron, and folate. 12. Chickpeas, great for protein and fiber. 13. Brown rice, a good source of complex carbs and B vitamins. 14. Whole grain bread, for folate and fiber.
Hello, expecting moms. Congratulations on reaching the third trimester of your pregnancy. As your due date approaches, it's important to stay active and maintain a healthy lifestyle. Today, we have compiled a set of safe and effective pregnancy exercises that will help you stay fit, reduce discomfort, and prepare your body for labor. Remember to consult with your healthcare provider before starting any new exercise routine. Let us get started. Point 1. Warm up. Begin with a gentle warm-up to increase blood flow and flexibility. March in place for 2 minutes to warm up your legs and get your heart rate up. Perform shoulder rolls and gentle arm circles to loosen up your upper body. Point 2. Pelvic tilts. Pelvic tilts help relieve lower back pain and strengthen your core. Stand or get on your hands and knees. Gently tilt your pelvis forward and backward, arching and rounding your back. Repeat for 10-15 reps, holding each position for a few seconds. Point 3. Squats. Squats are excellent for preparing your pelvic floor and thighs for labor. Stand with your feet shoulder width apart, toes pointing slightly outward. Slowly squat down as if you're sitting in a chair, keeping your back straight. Exhale as you come up and squeeze your glutes at the top. Aim for 3 sets of 10-12 squats. Point 4. Modified push-ups. Modified push-ups help strengthen your arms, chest, and core without straining your belly. Position yourself on your hands and knees. Lower your chest, tower chest. Point 5. Kegel exercises. Kegels strengthen the pelvic floor muscles, which can ease delivery and postpartum recovery. Sit or lie down comfortably. Squeeze your pelvic muscles as if you're trying to stop the flow of urine. Hold for 5-10 seconds and release. Aim for 3 sets of 10-15 repetitions. Point 6. Side-lying leg lifts. Side-lying leg lifts target the hips and outer thighs. Lie on your side with your head supported by your arm. Lift your top leg slowly, keeping it straight, and then lower it back down. Perform 12-15 reps on each side for 2 sets. Point 7. Cat-cow stretch. The cat-cow stretch helps improve flexibility and reduce back pain. Get on your hands and knees, aligning your wrists under your shoulders and knees under your hips. Arch your back while inhaling, bringing your head up cow position. Round your back while exhaling and tuck your chin towards your chest cat position. Repeat for 10-12 breath cycles. Conclusion. Congratulations, you've completed a safe and effective pregnancy workout for the third trimester. Remember to listen to your body and avoid any exercises that cause discomfort or pain. Staying active during pregnancy can lead to a smoother labor and quicker postpartum recovery. Don't forget to hydrate and get plenty of rest. If you enjoyed this workout, consider subscribing. Welcome back to our channel. Today, we're diving into the topic of normal delivery and discussing whether it's the right choice for expecting mothers. Giving birth is a transformative experience, and there are various methods available. Let us explore the pros and cons of opting for a normal delivery. Point 1. Natural process. Host. Normal delivery, also known as vaginal birth, is a natural process that has been practiced for centuries. Many argue that it is the way our bodies are designed to bring new life into the world. Pro. Natural process. Normal delivery allows the mother to experience the natural progression of labor, which can enhance the bond between mother and child. It also allows the mother's body to release hormones, such as oxytocin, which aid in breastfeeding and postpartum. Recovery. Con. Pain and discomfort. While normal delivery is a natural process, it can involve intense pain and discomfort during labor. This can be challenging for some women, and pain management techniques like breathing exercises and epidurals may be necessary. Point 2. Faster recovery. Host. Another aspect to consider is the recovery period after childbirth. Let us take a closer look at the pros and cons related to recovery. Pro. Faster recovery. Compared to a cesarean section, normal delivery typically results in a shorter hospital stay and faster postpartum recovery. Women who have a normal delivery may find it easier to resume their daily activities and care for their newborn. Con. Physical trauma. Despite the faster recovery, normal delivery can cause physical trauma, such as perineal tears. Recovery from these tears can take time and require additional care and attention. Point 3. Lower risk of complications. Host. Ensuring the safety of both the mother and baby during childbirth is a top priority. Let us discuss the pros and cons associated with the risk of complications. Pro. Lower risk of complications. In many cases, normal delivery is considered a safer option compared to cesarean sections. It carries a lower risk of infection, blood loss, and complications related to anesthesia. It also promotes natural immune system development for the newborn. Con. Unpredictability. Normal delivery is not without risks. Complications such as umbilical cord prolapse or shoulder dystocia can occur during labor. These situations require immediate medical intervention to ensure the well-being of both mother and baby. Point 4. Support and guidance. Host. Having a strong support system and access to guidance is crucial during childbirth. Let us explore the pros and cons related to support and guidance during normal delivery. Pro. Emotional support. Many women find comfort and reassurance in having their loved ones present during labor. The support of a partner, family members, or a doula can help alleviate anxiety and provide encouragement. Con. Limited control. While having a support system is beneficial, the process of normal delivery can sometimes be unpredictable. This lack of control can be challenging for some women, leading to increased stress and anxiety. Conclusion. Host. In conclusion, the decision to opt for a normal delivery or any other birthing method is a personal one that should be made after careful consideration. Let us summarize the pros and cons we've discussed. Normal delivery is a natural process that promotes the release of beneficial hormones and strengthens the mother-child bond. Faster recovery and shorter hospital stay are advantages of normal delivery, but physical trauma such as perineal tears may occur. Emotional support during labor can be comforting, but the lack of control in the process can cause stress and anxiety. Remember, every pregnancy is unique, and it's essential to consult with healthcare professionals to make an informed decision. We hope this video has provided you with valuable insights to help you make the best choice for yourself and your baby. Don't forget to like and subscribe. "6 weeks pregnant, your little one is developing new features." This week's most important milestone, the neural tube begins to close over what will become your baby's spinal cord. There's more. This week, the areas that will become the eyes and ears have started to project as bumps, and other tiny buds are forming that will eventually grow into arms and legs. A tiny heartbeat of about 105 beats per minute may be detectable in an ultrasound this week, and the brain and nervous system are also developing quickly. In fact, the nose, mouth, and inner and outer ears are just starting to take shape, along with the lungs. In just a few weeks, breathing tubes will form between the throat and the lungs, getting ready for your little one's first breath of air, and maybe a loud wail, at birth. The size of the embryo at 6 weeks pregnant. At 6 weeks, your embryo measures an average of 0.08 to 0.2 inches, about the size of a pomegranate seed. Take a look at the visual below to get an idea of how things are progressing inside your belly. At 6 weeks, when it comes to the embryo, things are starting to take shape. Mom's body at 6 weeks pregnant. This week, your breasts may feel tender or achy because of increased blood flow. This is a normal part of your body preparing for breastfeeding. Wearing a supportive bra can help with discomfort. You may also experience constipation because of an increase in progesterone, which slows down the digestive tract. To deal with this, exercise regularly, eat a balanced diet with high-fiber foods, and drink plenty of water. 6 weeks pregnant, your symptoms. At 6 weeks pregnant, here are some of the symptoms you may be experiencing. Spotting. It's not unusual to see some spotting at 6 weeks, but it should be light, not even enough to cover a small pantoliner. This implantation bleeding is normal, but if you see a lot of blood, if the spotting lasts longer than 2 days, or you have any concerns, be sure to see your doctor right away. Cramping. At 6 weeks pregnant, slight cramping can be normal. It's a sign your uterus and the surrounding tissues are expanding to make room for your baby. If you feel pain more severe than usual period cramping, especially if accompanied by a fever or diarrhea, contact your doctor immediately. Morning sickness. If you haven't yet had morning sickness, this may be the week it arrives. Morning sickness can happen any time of day or night. It may be triggered by certain movements, smells, an empty stomach, or nothing at all. Crackers and other simple, starchy foods can help, so keep a little something on hand for those random bouts of nausea. Exhaustion. You may feel completely exhausted due to pregnancy fatigue, and that's okay. As your levels of the pregnancy hormone progesterone are increasing, making you more and more tired, you may find taking naps can help. Some women also say that little snacks and some light exercise are effective in fighting off fatigue. Ways to help yourself feel a bit better. No symptoms. That's right, it's possible to be 6 weeks pregnant with no symptoms whatsoever. Every pregnancy and every woman is different. For example, some women never experience morning sickness, so if you're one of the lucky few, enjoy these nausea-free days without worry.
IUI stands for intrauterine insemination, which is a fertility treatment used to increase the chances of pregnancy. The procedure involves placing sperm directly into a woman's uterus to facilitate fertilization. IUI is commonly used to treat infertility due to low sperm count, decreased sperm motility, or issues with cervical mucus. Prior to the procedure, the woman may receive ovulation-inducing medication to increase the likelihood of successful fertilization. IUI is a relatively simple and non-invasive procedure that can be performed in a doctor's office. It is usually painless and does not require anesthesia. The success rate of IUI varies depending on several factors, including age, fertility issues, and the number of insemination cycles performed. The risks of IUI are minimal, but there is a small risk of infection or discomfort. IUI is often combined with other fertility treatments, such as in vitro fertilization, IVF, to improve the chances of pregnancy. Overall, IUI can be an effective treatment option for couples struggling with infertility, but it is important to discuss all available options with a fertility specialist to determine the best course of action.
Journey through the stages of pregnancy. Objectives. Define the 3 main stages of pregnancy: the first trimester, second trimester, and third trimester. Identify and describe the approximate duration of each pregnancy stage, including the weeks and months. Explain the physical and hormonal changes that occur during each pregnancy. What is pregnancy? Pregnancy is a biological process in which a woman's body nurtures and develops a fertilized egg, leading to the growth and development of an embryo and fetus inside the uterus. It occurs when a sperm cell fertilizes an egg, resulting in the formation of a zygote. The stages of pregnancy are typically divided into 3 trimesters, each approximately 3 months long. Throughout pregnancy, the fetus grows and develops, forming organs, tissues, and body systems. The average duration of pregnancy is around 40 weeks, calculated from the first day of the woman's last menstrual period. First trimester pregnancy. Pregnancy weeks 1 to 4. Fertilized egg travels down the fallopian tube and implants into the uterine lining. The fertilized embryo begins to form and consists of a cluster of cells. Development of the neural tube, which will become the brain and spinal cord, begins. Formation of the placenta connecting the embryo to the mother's bloodstream. Pregnancy weeks 5-8. The embryo grows rapidly. Basic features of the baby begin to take shape. The umbilical cord forms, connecting the baby to the placenta. The neural tube closes, marking the completion of the baby's spinal cord. The placenta grows and takes on a crucial role in pregnancy weeks 9-13. Major organ systems have formed, and the baby's structure is more defined. The fetus develops fingers and toes, which are initially webbed but begin to separate. Facial features become more distinct, and the eyes may move closer together. Muscles develop, allowing the fetus to make spontaneous movements. Second trimester pregnancy weeks 14 to 17. Many of the major organs and body systems functioning or nearing functionality. Fine hair called lanugo begins to cover the baby's body to provide insulation. Bones continue to harden and muscles develop, enabling coordinated movements. The baby starts to practice swallowing and can even suck its thumb. Pregnancy weeks 18-22. The baby experiences a substantial growth spurt with an increase in size and weight. The baby's senses continue to develop, and it can now hear sounds from the outside world. The skeleton continues to develop, and the bone marrow produces red blood cells. A waxy substance starts to form on the baby's skin to protect it in the amniotic fluid. Pregnancy weeks 23-27. The baby's growth continues at a rapid pace, and their body becomes more proportionate. Lungs continue to develop, and respiratory movements, such as practice breathing, occur. Skin becomes less translucent as fat deposits start to develop beneath the skin. Eyelids and eyebrows are fully formed, and the baby's eyes begin to open. Third trimester pregnancy weeks 28-31. Brain development progresses, with the nervous system becoming more complex. The baby's position may shift, with the head typically moving downward into the pelvis. Movements may be more vigorous as they have limited space in the uterus. Organs continue to mature, increasing their readiness for independent functioning. Pregnancy weeks 32-35. The baby gains more weight, accumulating fat layers under their skin for energy reserves. The baby's head settles deeper into the pelvis, positioning itself for delivery. Organ systems further mature and develop in preparation for life outside the womb. Movements may feel more restricted due to increasing size and limited space. Pregnancy weeks 36-40. The baby's growth slows down, but they continue to gain weight and size. The baby's head becomes engaged in the pelvis, settling into a position for birth. The baby's organs are fully developed and ready for independent functioning. The baby's bones and skull remain flexible to facilitate the birthing process.
Top 20 Tips for Natural Conception, your ultimate guide. 1. Understand your menstrual cycle. Track your menstrual cycle to identify your fertile days. 2. Healthy lifestyle. Maintain a balanced diet, exercise regularly, and avoid excessive stress. 3. Maintain a healthy weight. Both underweight and overweight can affect fertility, so strive for a healthy BMI. 4. Regular exercise. Engage in moderate exercise to enhance overall health and reproductive function. 5. Limit caffeine and alcohol. Excessive caffeine and alcohol intake can impact fertility, so consume them in moderation. 6. Quit smoking. Smoking can reduce fertility, so kick the habit for a healthier reproductive system. 7. Adequate sleep. Ensure you get enough quality sleep to support hormonal balance. 8. Stay hydrated. Drink plenty of water to keep your body well hydrated. 9. Nutrient-rich diet. Include foods rich in vitamins and minerals essential for reproductive health. 10. Folic acid. Intake. Take a prenatal vitamin with folic acid to reduce the risk of neural tube defects. 11. Reduce toxin exposure. Limit exposure to environmental toxins that can impact fertility. 12. Know your ovulation signs. Recognize ovulation signs such as changes in cervical mucus and basal body temperature. 13. Optimal sexual positions. Certain positions may increase the chances of sperm reaching the egg. 14. Regular intimacy. Aim for regular intercourse, especially during your fertile window. 15. Reduce stress. Practice stress-reducing techniques like meditation or yoga to promote fertility. 16. Avoid lubricants with spermicidal agents. Choose fertility-friendly lubricants to enhance sperm motility. 17. Limit hot baths and saunas. Excessive heat can negatively impact sperm production, so avoid prolonged exposure. 18. Partner's health matters. Ensure your partner maintains a healthy lifestyle for optimal sperm quality. 19. Medical checkup. Visit a healthcare professional for a preconception checkup to address any potential issues. 20. Patience and persistence. Understand that conception may take time. Stay positive and persistent. Remember, these tips are general guidance. If you encounter challenges, consult with a healthcare professional for personalized advice.
10 Healthcare Needs of Pregnant Teenagers and Their Babies. 1. Pregnant teenagers have unique healthcare needs that require specialized care and attention. 2. Prenatal care is critical for ensuring a healthy pregnancy and reducing the risk of complications for both the mother and baby. 3. Teenage mothers are more likely to experience pregnancy-related complications, such as preterm labor and low birth weight babies. 4. Adequate nutrition and regular exercise are essential for the health of both the mother and baby during pregnancy. 5. Teenage mothers may require additional emotional and psychological support throughout their pregnancy and after giving birth. 6. Babies born to teenage mothers are at higher risk of health problems and developmental delays. 7. Early and regular pediatric care is essential for ensuring the health and development of babies born to teenage mothers. 8. Teenage mothers may require education and support in breastfeeding, as breast milk provides essential nutrients and immunity for babies. 9. Family planning and contraception counseling should be provided to teenage mothers to prevent unintended pregnancies in the future. 10. Providing comprehensive healthcare services to pregnant teenagers and their babies is crucial for improving maternal and child health outcomes.
The size of this at 16 weeks pregnant. At 16 weeks, your fetus is now the size of an apple. Your little one could be more than 4.5 inches long, crown to rump, and weigh close to 4 ounces. How big is my baby at 16 weeks? Your baby now weighs in at a whopping 3 to 4 ounces, and is 4 to 5 inches in length. The backbone and tiny muscles in your baby's back are gaining strength, so she can straighten out that head and neck even more. Thanks to those developing facial muscles, your baby is capable of making a few expressive frowns and squints, even at this early stage. Baby's beautiful eyes are finally working too, making small side-to-side movements and perceiving light, although the eyelids are still sealed. Delicate baby skin. Your baby's skin is thin and translucent. It will thicken and develop as your pregnancy progresses, but will continue to be almost transparent for quite some time. And here's the skinny on baby skin, it's practically translucent now, so if you took a peek inside your uterus, you'd be able to see your baby's blood vessels under that thin skin. Scalp patterning. On your baby's scalp, hair follicles are forming a pattern that will remain for life. This patterning sets the stage for how your baby's hair will grow. New hair follicles don't form after birth, so babies are born with all the hair follicles they'll ever have. Heart at work. Your baby's heart is now pumping about 25 quarts of blood each day, and this amount will continue to increase as your little one develops. Baby will soon hear your voice. Listen up, tiny bones in your fetus ears are in place, making it likely that baby will soon be able to hear your voice, or something like it, when you're speaking. Generally, babies fully develop the ability to hear in the womb by 18 weeks of pregnancy. During its 16th week of development, a fetus will be starting to form facial expressions, and its nervous system will be growing. Your body at week 16. Rapid growth. At 16 weeks pregnant, your uterus is growing at about the same pace as your baby's. It's getting to the point where you may not be able to hide your pregnancy anymore, even if you wanted to. Your 16 weeks pregnant belly. At 16 weeks pregnant, you may now be at the stage where your bump clearly has a baby in there. Your pregnancy weight gain. It may be hard to watch yourself gain weight during pregnancy, even when you know there's a wonderful reason for it, but try to embrace your body's new shape and think of every pound you put on as a sign of good health for you and your baby. Nasal congestion. 16 weeks pregnant, your symptoms. At 16 weeks pregnant, here are some of the symptoms you may be experiencing. Skin changes. You might have heard about the pregnancy glow, and now it might be your turn to experience it. Increased blood volume in the blood vessels and pregnancy hormones causing more oil production can make pregnant skin look flushed and dewy. Nosebleeds. At 16 weeks pregnant, nosebleeds can be an issue for some moms-to-be, and might be caused by increased circulation and higher levels of hormones. Lower back pain. This is one of the most common symptoms that can strike when you're pregnant, and it's good to have some strategies to avoid or lessen the discomfort. For example, take warm baths or showers, stretch regularly to help your hardworking back muscles relax, pay attention to your posture, and wear low-heeled shoes. Dizziness. Round ligament pain. As your amazing uterus grows, the round ligaments that support it are thickening and stretching. Breast changes. Pregnancy headaches. Sure, let us break down the key points for each trimester. First trimester, weeks 112, early signs and development overview of conception and early fetal development. Common symptoms like morning sickness, fatigue, and hormonal changes. Importance of prenatal vitamins and a healthy diet. Weeks 5-8, organ formation of vital organs and major body systems. Discuss potential early ultrasound and first heartbeat. Weeks 9-12, transition to second trimester, gradual reduction of some early symptoms. Introduction of prenatal screenings and tests. Second trimester, weeks 13-16, visible changes, baby's growth spurt and noticeable changes in the mother's body. Announcement of pregnancy to friends and family, weeks 17-20, gender reveal, discussion on when and how gender can be determined. Introduction of anatomy scan and potential genetic testing. Weeks 21-24, viability and quickening fetal viability milestone. First experiences of fetal movements quickening. Third trimester, weeks 25-28, final trimester begins overview of the home stretch. Importance of monitoring baby's movements. Weeks 29-32, preparing for labor discussion on birthing classes and birth plans. Baby shower preparations and nesting instincts. Weeks 33-40, final preparations, physical and emotional changes in the mother. Signs of labor and when to contact healthcare provider. Packing hospital bag and finalizing birth plan. Postpartum, labor and delivery overview of labor stages and delivery options. Postpartum recovery and care for both mom and baby. Newborn care, basics of newborn care, feeding, and sleep. Emotional adjustments and potential postpartum support. Remember, this is just an outline. Feel free to expand on each point based on your audience and the depth you want to cover. Welcome back to our channel, where we provide valuable information and support for those on their journey from infertility to fertility. Today, we'll be discussing the step-by-step process of transitioning from infertility to achieving a successful pregnancy. If you're new here, don't forget to hit the subscribe button and the notification bell so you won't miss any of our informative videos. Let us dive right into it. Step 1, seeking professional help. The first crucial step in the journey is seeking professional help. Consult a reproductive endocrinologist or fertility specialist to evaluate your medical history, conduct tests, and diagnose any underlying issues causing infertility. Step 2, diagnosis and treatment plan. Once diagnosed, your fertility specialist will create a personalized treatment plan. This may include lifestyle changes, medications, or advanced assisted reproductive technologies like in vitro fertilization (IVF), intrauterine insemination (IUI), or egg freezing. Step 3, lifestyle and dietary changes. Making positive lifestyle changes can significantly impact your fertility. Maintain a healthy weight, exercise regularly, and consume a balanced diet rich in vitamins, minerals, and antioxidants. Reducing stress through activities like yoga or meditation can also be beneficial. Step 4, medications and hormonal therapy. In some cases, hormonal imbalances may be causing infertility. Your specialist might prescribe medications to regulate your hormones and improve your chances of conception. Step 5, assisted reproductive technologies (ART). When other methods aren't successful, you may explore assisted reproductive technologies such as IVF. This involves fertilizing eggs with sperm in a laboratory and transferring the resulting embryos into the uterus. Step 6, egg or sperm donation. If needed, you may consider using donated eggs or sperm. This option is often chosen when a partner has low-quality eggs or sperm or in cases of same-sex couples. Step 7, surrogacy. Surrogacy is another option for individuals or couples who can't carry a pregnancy themselves. A surrogate mother carries the pregnancy on behalf of the intended parents. Step 8, adoption. If achieving a biological pregnancy isn't possible, adoption is a wonderful way to build a family. Adoption agencies can help match you with a child, and the process varies by country and jurisdiction. Step 9, emotional support. Throughout this journey, emotional support is essential. Consider joining support groups, seeking therapy, or confiding in close friends and family members who can provide comfort and understanding. Step 10, patience and persistence. Remember, the path from infertility to fertility can be challenging, but staying patient and persistent is key. Celebrate small victories, lean on your support network, and never lose hope. Conclusion, host, that wraps up our step-by-step guide on transitioning from infertility to fertility. We hope you found this information helpful and encouraging. If you have any questions or would like us to cover specific topics in the future, please leave a comment below. Don't forget to give this video a thumbs up and share it with anyone who might benefit. Thank you for watching, and we'll see you in the next video. Stay strong and keep believing in the
Step-by-step guide to in vitro fertilization, IVF. How IVF works. 1. Introduction. Welcome to our step-by-step guide to in vitro fertilization, or IVF, the groundbreaking process that's helped countless families realize their dreams of parenthood. 2. Step 1. Fertility medications. The journey begins with fertility medications, typically administered as shots. These medications stimulate your ovaries to produce multiple mature eggs. The goal, to harvest 10-15 eggs, a process that typically takes about 2 weeks until your eggs are ready for retrieval. 3. Step 2. Egg retrieval. Next up is the egg retrieval process, a brief procedure lasting 15 to 30 minutes. During retrieval, a doctor utilizes ultrasound guidance to insert a thin, hollow tube through your vagina and into the ovary containing the eggs. A suction device connected to a needle gently retrieves the eggs from each follicle. 4. Step 3. Fertilization. Now, it's time for fertilization, a critical stage in the IVF process. In traditional IVF, eggs and sperm are left in a laboratory dish to fertilize naturally. Alternatively, in intracytoplasmic sperm injection, ICSI, a single sperm is directly injected into the egg for fertilization. This method bypasses natural barriers, increasing the likelihood of successful fertilization. 5. Step 4. Embryo development. Once fertilization occurs, the embryo begins to divide its cells, eventually reaching the blastocyst stage, 5-6 days post-fertilization. At this stage, multiple embryos are carefully selected for transfer back into your uterus. 6. Step 5. Embryo transfer. The final step, embryo transfer. Multiple embryos are transferred back into your uterus with the hope that at least one will successfully implant and begin to develop. 7. Conclusion. And there you have it, a comprehensive overview of the IVF process, from fertility medications to embryo transfer. If you're considering IVF or simply curious about the procedure, don't hesitate to reach out to a qualified fertility specialist. Thanks for joining us, and we wish you all the best on your journey to parenthood.
Welcome back to our channel. Today, we're diving into a topic that many of you have requested, the early signs of pregnancy. Whether you're trying to conceive or just curious, these symptoms could be indicators of an exciting journey ahead. Point 1. Missed period. One of the most common early signs is a missed period. The absence of your regular menstrual cycle could signal pregnancy. Point 2. Breast changes. Pay attention to changes in your breasts. Increased sensitivity, tenderness, and darkening of the areolas might occur. Point 3. Fatigue. Feeling unusually tired or exhausted. Pregnancy hormones can cause fatigue. Point 4. Nausea and morning sickness. Many pregnant women experience nausea, often referred to as morning sickness. It can occur at any time of day and might be triggered by certain smells or foods. Point 5. Frequent urination. Have you noticed yourself visiting the bathroom more often? Pregnancy can lead to increased urination due to hormonal changes. Point 6. Food aversions and cravings. Your taste preferences might suddenly change. Cravings for foods or aversions to others could be a sign. Point 7. Mood swings. Hormonal fluctuations during early pregnancy can impact your mood. Don't be surprised if you find yourself feeling emotional or irritable. Point 8. Abdominal bloating. Some women experience bloating or a feeling of fullness in the abdomen. It could be attributed to changes in hormones and digestion. Point 9. Increased basal body temperature. If you've been tracking your temperature, you might notice a sustained rise. This can indicate pregnancy, but it's important to track consistently. Point 10. Implantation. Bleeding. Spotting or light bleeding might occur when the fertilized egg attaches to the uterine lining. It's often mistaken for a light period. Conclusion. Keep in mind that these symptoms can vary widely among individuals. If you suspect you might be pregnant, it's always a good idea to take a home pregnancy test or consult with a healthcare professional for accurate guidance. Outro. Thanks for joining us today. If you found this video helpful, don't forget to hit that like button and subscribe for more informative content. Remember, every pregnancy journey is unique, so stay informed and take care of yourself. Until next time.
Understanding common causes of poor egg quality. Intro. Hello everyone. Welcome back to our channel. Today we'll be diving into a crucial topic for those navigating fertility and reproductive health, the common causes of poor egg quality. If you're new here, don't forget to subscribe and hit the notification bell so you never miss out on valuable information. Let's jump right in. 1. Age. As we age, the quality of our eggs naturally declines. Advanced maternal age is a significant factor in poor egg quality. 2. Hormonal imbalances. Imbalances in hormones, such as FSH and LH, can impact egg quality. Maintaining hormonal balance is crucial for optimal fertility. 3. Smoking. Smoking is known to accelerate the depletion of ovarian reserve and negatively affect egg quality. Quitting smoking can positively impact fertility. 4. Poor diet. A nutrient-rich diet is essential for reproductive health. Lack of key vitamins and minerals can compromise egg quality. Focus on a well-balanced diet. 5. Obesity. Being overweight can disrupt hormonal balance and affect egg quality. Maintaining a healthy weight is vital for fertility. 6. Underweight. Conversely, being underweight can also impact fertility. Adequate nutrition is essential for optimal egg development. 7. Environmental toxins. Exposure to environmental toxins, such as pollutants and chemicals, can negatively affect egg quality. Minimize exposure whenever possible. 8. Stress. Chronic stress can disrupt hormonal balance and impact reproductive health. Incorporating stress management techniques is crucial for fertility. 9. Alcohol consumption. Excessive alcohol intake can be detrimental to egg quality. Moderation is key when it comes to alcohol consumption during fertility journeys. 10. Lack of exercise. Regular exercise promotes overall health, including reproductive health. Sedentary lifestyles may contribute to poor egg quality. 11. Ovulation disorders. Irregular ovulation patterns or disorders can lead to poor egg quality. Seeking medical advice for irregular cycles is important. 12. Genetic factors. Some individuals may have genetic predispositions that affect egg quality. Genetic counseling can provide valuable insights. 13. Polycystic ovary syndrome, PCOS. PCOS can impact hormonal balance and egg development. Managing PCOS through lifestyle changes and medical interventions is crucial. 14. Endometriosis. Endometriosis can affect egg quality by causing inflammation. Seeking treatment for endometriosis is essential for fertility. Thyroid disorders. Thyroid imbalances can impact reproductive health. Regular thyroid monitoring and management are important for optimal fertility. Diabetes. Uncontrolled diabetes can affect egg quality. Managing blood sugar levels is crucial for individuals with diabetes trying to conceive. Autoimmune disorders. Some autoimmune disorders can affect fertility. Consultation with a specialist is recommended for those with autoimmune conditions. Poor egg reserve. Low ovarian reserve can contribute to poor egg quality. Regular fertility assessments can help understand and address this issue. Infections. Untreated infections can negatively impact reproductive organs and egg quality. Prompt medical attention is important. Medication side effects. Some medications may have side effects that affect fertility. Consult your healthcare provider if you have concerns about medications and fertility. Outro. That wraps up today's video on the common causes of poor egg quality. If you found this information helpful, don't forget to give it a thumbs up and share it with others who might benefit. Remember, every fertility journey is unique, and seeking professional advice is crucial. Until next time, stay informed and take care of your reproductive health. Thanks for watching. Unlocking the secret to boost female fertility. Top 20 foods for improved egg quality. Introduction. Hello everyone. Welcome back to our channel. Today we have an incredibly important topic to discuss, something that many women may find valuable on their fertility journey. We'll be diving into the top 20 foods that can significantly enhance female egg quality. If you're ready to unlock the secret to boosting your fertility, stay tuned. Segment 1: Importance of female egg quality. Before we get into the list, let's understand why female egg quality is crucial for conception. The quality of your eggs plays a pivotal role in fertility, affecting not just the likelihood of conception, but also the health of the baby. Now, let's jump into the first set of foods that can make a positive impact. Segment 2: Dark leafy greens. Our number 1 on the list is dark leafy greens such as spinach and kale. Packed with essential nutrients like folate and iron, these greens promote optimal egg development and overall reproductive health. Add a generous serving of these greens to your diet for a fertility boost. Segment 3: Berries. Next up, we have berries. Blueberries, strawberries, and raspberries. Loaded with antioxidants, these little powerhouses protect your eggs from oxidative stress, enhancing their quality. Snack on a handful of berries daily to give your fertility a sweet and nutritious kick. Segment 4: Avocado. Moving on to number 3, avocados. Rich in monounsaturated fats and vitamin E, avocados support hormonal balance and nourish your reproductive system. Incorporating avocados into your diet can positively impact your egg quality over time. Segment 5: Fatty fish. Let's talk about fatty fish like salmon and mackerel, omega-3. Fatty acids found in these fishes are essential for reproductive health. They not only improve egg quality, but also contribute to a healthy pregnancy. Aim for at least 2 servings of fatty fish per week. Segment 6: Nuts and seeds. Nuts and seeds come in at number 5. Almonds, walnuts, and flax seeds are rich in omega-3s and antioxidants, promoting better egg quality. Snacking on a handful of these daily can be a simple yet effective way to boost your fertility. Segment 7: Quinoa. Quinoa takes the 6th spot on our list. This whole grain is a fantastic source of protein and essential amino acids, supporting overall reproductive health. Swap out refined grains for quinoa to give your body the nutrients it needs for optimal eggs quality. Segment 8: Greek yogurt. Number 7 is Greek yogurt. Packed with protein and probiotics, Greek yogurt promotes a healthy gut, positively influencing your reproductive system. Choose the unsweetened variety for maximum benefits. Segment 9: Broccoli. Broccoli, our 8th contender, is rich in folate and other crucial nutrients. It aids in regulating hormones and supporting healthy egg development. Steam or stir-fry broccoli as a tasty and nutritious side dish to boost your fertility. Segment 10: Lean protein. Lean protein sources like chicken and turkey make it to number 9. Protein is essential for overall health, and incorporating lean sources into your diet helps provide the necessary building blocks for optimal egg quality. Segment 11: Eggs. It might sound cliche, but eggs are our number 10. They are a fantastic source of high-quality protein, choline, and antioxidants. Including eggs in your diet can contribute to improved egg quality over time. Segment 12: Citrus fruits. Let's move on to number 11, citrus fruits like oranges and grapefruits. Packed with vitamin C, these fruits support the production of collagen, a crucial component for healthy eggs. Add a citrusy twist to your diet for a fertility boost. Segment 13: Pumpkin seeds. Pumpkin seeds claim the 12th spot on our list. These tiny seeds are rich in zinc, a mineral essential for reproductive health. Snacking on pumpkin seeds can contribute to better egg quality and hormonal balance. Segment 14: Beans and lentils. Beans and lentils come in at number 13. These plant-based protein sources are high in fiber and essential nutrients, supporting hormonal balance and reproductive health. Incorporate a variety of beans and lentils into your meals. Segment 15: Sweet potatoes. Number 14 is sweet potatoes. Packed with beta-carotene and vitamin A, sweet potatoes support healthy egg development. Swap regular potatoes for the sweet variety to enhance your fertility. Segment 16: Tomatoes. Tomatoes take the 15th spot. Rich in lycopene, an antioxidant, tomatoes support reproductive health by protecting eggs from damage. Add fresh tomatoes to your salads or enjoy them in cooked dishes. Segment 17, asparagus. Asparagus claims the 16th spot. This green veggie is loaded with folate, promoting optimal egg quality and hormonal balance. Steam or roast asparagus for a delicious and fertility-boosting side dish. Segment 18, beets. Beets at number 17 are rich in nitrates and antioxidants. They support blood flow to the reproductive organs, positively influencing egg quality. Incorporate beets into your diet for a natural fertility boost. Segment 19, lean red meat. Lean red meat makes it to number 18. Rich in iron and zinc, red meat supports overall reproductive health. Choose lean cuts and enjoy them in moderation to enhance your fertility. Segment 20, water. Last but not least, staying hydrated is crucial for optimal fertility. Drinking enough water ensures proper circulation, supporting the delivery of nutrients to the reproductive organs. So, don't forget to keep yourself well hydrated throughout the day. Conclusion? And there you have it, the top 20 foods to improve female egg quality. Remember, making these dietary changes is a journey, and consistency is key. If you found this video helpful, give it a thumbs up, and don't forget to subscribe for more valuable content. Wishing you all the best on your fertility journey. Until next time, take care. Outro. Thank you for watching, and we'll see you in the next video. Stay healthy and happy. Top 15 Baby Boy Pregnancy Symptoms. Hey everyone, welcome back to the channel. Are you curious about whether you're having a baby boy? While the only way to know for sure is through an ultrasound or genetic testing, there are some fun old wives' tales and symptoms that people believe might hint at a baby boy. Today, I'm sharing 15 common pregnancy symptoms that some say could mean you're carrying a little prince. Let's dive in. Before we start, remember, these are just for fun and not scientifically proven. Every pregnancy is unique, so take these with a grain of salt. Let's begin. 1. Carrying low. One of the most popular myths is that if you're carrying low, it's a boy. High, maybe a girl. But again, this is just a fun guess. 2. Minimal morning sickness. Some say that if you have little to no morning sickness, it could be a sign of a baby boy. Severe nausea. Maybe a girl. 3. Craving salty and savory foods. Craving chips, pickles, or burgers? Some believe that salty and savory cravings mean you're having a boy. Sweet cravings? Maybe a girl. 4. Glowing skin. Another myth is that if your skin is clear and glowing, you're carrying a boy. Acne or breakouts? Some say it's a girl. 5. Faster fetal heart rate. Some people believe that if the baby's heart rate is under 140 beats per minute, it's a boy. Over 140? Maybe a girl. 6. Increased appetite. Feeling hungrier than usual? Some say this could mean you're having a boy because boys supposedly require more calories. 7. Hair growth. noticing thicker or faster growing hair. Some believe this is a sign of a baby boy. 8. Cold feet. Oddly enough, some say that if your feet are colder than usual, it could mean you're having a boy. 9. Belly shape. If your belly looks more like a basketball, some say it's a boy. If it's rounder, maybe a girl. 10th, mood stability. Feeling more even-keeled emotionally? Some believe this is a sign of a baby boy. Mood swings? Maybe a girl. 11th, linea nigra. If the dark line on your belly, linea nigra, runs past your belly button, some say it's a boy. If it stops at the belly button, maybe a girl. 12. Dreams about boys. Dreaming about baby boys? Some people believe this could be a sign you're having one. 13. Dad's weight gain. Oddly enough, some say that if the dad-to-be is gaining weight too, it could mean you're having a boy. 14. Urine color. Another quirky myth is that if your urine is bright yellow, it's a boy. Duller? Maybe a girl. 15. Baby's position. Some believe that if the baby is more active on the left side, it's a boy. Right side? Maybe a girl. And there you have it. 15 fun symptoms that some people believe could mean you're having a baby boy. Remember, these are just myths and not scientifically proven, so take them with a pinch of salt. The best way to know is through your ultrasound or genetic testing. If you enjoyed this video, give it a thumbs up, share it with your friends, and don't forget to subscribe for more pregnancy tips and fun facts. See you next time.
Introduction. Greet your viewers warmly. Briefly share your excitement about documenting your pregnancy journey. Week 4-6, Discovery. Discuss how you found out about the pregnancy. Share your initial thoughts and emotions. Week 7-10, First trimester symptoms. Detail common symptoms like morning sickness and fatigue. Offer tips on coping with these symptoms. Week 11-13, First ultrasound. Share your experience with the first ultrasound. Discuss any surprises or emotions during this appointment. Week 14-16, Gender reveal. If you've discovered the gender, reveal it to your audience. Share any creative or special gender reveal ideas you used. Week 17-20, Second trimester milestones. Discuss improvements in symptoms. Share any notable milestones, like feeling the first kicks. Week 21-24, Maternity fashion. Showcase your favorite maternity outfits. Offer tips for staying stylish and comfortable. Week 25-28, Baby shower preparation. Discuss planning and organizing your baby shower. Share any memorable moments from the celebration. Week 29-32, Third trimester challenges. Address common challenges like back pain and sleep difficulties. Offer advice on staying comfortable during this stage. Week 33-36, Nesting and preparing. Show your audience how you're preparing for the baby's arrival. Discuss any nesting instincts or rituals you've experienced. Week 37-40, Final countdown. Share your thoughts and emotions as you approach your due date. Discuss any last-minute preparations or anxieties. Labor and delivery. Document your labor experience as much as you're comfortable. Share your feelings and reactions during the delivery. Welcome baby, Postpartum. Introduce your newborn to your audience. Discuss your postpartum experiences and emotions. Conclusion. Express gratitude to your viewers for joining you on this journey. Share your plans for future videos or updates on your growing family.
Hello everyone, and welcome to this week's video about pregnancy symptoms and baby development at 27 weeks. At this point in your pregnancy, you're already well into your second trimester, and your baby is continuing to grow and develop at an incredible pace. Let's start by talking about some of the common pregnancy symptoms you may be experiencing at 27 weeks. One of the most noticeable changes may be the size and shape of your belly, which is likely to be much larger now than it was just a few weeks ago. You may also be experiencing some swelling in your feet and ankles, as well as back pain and discomfort as your baby continues to put pressure on your spine and pelvic area. Other common symptoms at this stage of pregnancy can include indigestion, heartburn, and constipation, as well as increased fatigue and difficulty sleeping. It's important to continue to take care of yourself during this time by eating a healthy diet, staying hydrated, and getting plenty of rest whenever possible. Now, let's talk about your baby's development at 27 weeks. At this stage, your baby is approximately 14.8 inches long and weighs around 2 pounds. Their eyes are now fully formed, and they are able to blink and open and close their eyes. They are also developing their sense of hearing and may be able to recognize your voice and other familiar sounds. Your baby's lungs are continuing to develop, and they may even be practicing breathing movements in preparation for their arrival into the world. They are also beginning to store up fat, which will help to keep them warm after they are born. Another important development at this stage is the development of your baby's brain. As your baby's brain continues to grow and develop, they may begin to exhibit more complex behaviors and movements, such as grabbing onto the umbilical cord or sucking their thumb. As your due date approaches, it's important to begin thinking about your birth plan and discussing your options with your healthcare provider. This may include deciding on whether or not to use pain medication during labor, as well as considering different birthing positions and other options that can help you to have a safe and comfortable delivery. In addition to preparing for your delivery, it's also a good idea to begin thinking about your postpartum care and support. This may include arranging for help with childcare and household tasks, as well as seeking out resources for emotional counseling. As always, if you have any questions or concerns about your pregnancy, it's important to talk to your healthcare provider for advice and guidance. So that's it for this week's video on pregnancy symptoms and baby development at 27 weeks. Thanks for tuning in, and we'll see you in next video. Hello everyone, and welcome back to our pregnancy journey. Today, we are at the 28-week mark, which means we are officially in the third trimester. In this video, we will discuss the symptoms you may experience at this stage of pregnancy and how your baby is developing. First, let's talk about some common symptoms you may experience during the 28th week of pregnancy. At this point, your baby is growing rapidly, which can put a lot of strain on your body. You may feel more tired than usual, and you may also experience shortness of breath as your growing baby puts pressure on your lungs. You may also experience swelling in your hands, feet, and ankles as your body retains more fluid. This is normal, but if you notice severe swelling, be sure to speak with your healthcare provider as it can be a sign of preeclampsia, a serious pregnancy complication. Heartburn and indigestion are also common during the third trimester as your growing uterus puts pressure on your stomach, leading to acid reflux. Eating small, frequent meals and avoiding spicy or acidic foods can help alleviate these symptoms. Now let's talk about your baby's development at 28 weeks. At this stage, your baby weighs around 2.5 pounds and is approximately 15 inches long. Their brain is developing rapidly, and they can now blink their eyes, which have formed fully. Your baby's lungs are also developing, and although they are not yet fully functional, they are producing surfactant, a substance that helps the lungs expand and contract. This is an important milestone in your baby's development as it prepares them for life outside the womb. Your baby's senses are also developing at this stage, and they can now hear your voice and your heartbeat. You may notice that your baby becomes more active when you talk or sing to them. As your baby continues to grow, they will start to gain more fat, which will help regulate their body temperature after birth. They will also continue to practice breathing, and by the end of the third trimester, they will be able to hiccup. So, what can you expect during the rest of the third trimester? As your due date approaches, you may experience more intense Braxton Hicks contractions, which are practice contractions that help prepare your body for labor. You may also notice an increase in vaginal discharge, which is normal but should not have a strong odor or be accompanied by itching or burning. It is also important to start preparing for labor and delivery. Talk with your healthcare provider about your birth plan and attend childbirth education classes to learn about the different stages of labor and coping techniques for pain. In summary, at 28 weeks pregnant, you may experience symptoms such as fatigue, shortness of breath, and swelling. Your baby is rapidly growing and developing, and they can now hear your voice and blink their eyes. As you move into the third trimester, be sure to continue monitoring your symptoms and preparing for labor and delivery. That's all for today's video. Thank you for watching, and be sure to subscribe to our channel for more pregnancy updates.
Hello, and welcome back to our pregnancy journey. Today we're going to talk about the 29 week of pregnancy and what you can expect for both your baby's development and your own body changes. Let's start with your baby. At this point, your little one is roughly the size of a butternut squash, weighing in at around 2.5 pounds and measuring about 15 inches long from head to toe. Your baby's brain is continuing to develop rapidly, and their lungs are starting to produce surfactant, a substance that helps them breathe on their own outside of the womb. Your baby's movements are becoming more pronounced, and you may start to notice a pattern of when they are most active. They are also starting to develop their sense of taste and can taste the amniotic fluid they swallow. Now, let's talk about your body changes. At 29 weeks pregnant, you may notice that your belly is getting bigger, and you're feeling more and more pregnant every day. As your uterus continues to expand, you may experience some discomfort or even pain in your lower back, hips, or pelvis. This is normal, but if you're concerned, talk to your healthcare provider. You may also notice some new symptoms, such as Braxton Hicks contractions. These are practice contractions that feel like your uterus is tightening and releasing. They're usually painless and irregular, but if you're experiencing them frequently or with any pain or discomfort, it's important to let your healthcare provider know. Other common symptoms at this stage of pregnancy include shortness of breath, heartburn, and difficulty sleeping. If you're having trouble sleeping, try sleeping on your left side with a pillow between your knees to support your lower back and hips. It's also important to keep up with your prenatal appointments and any recommended tests or screenings. At your 29-week appointment, your healthcare provider may check your blood pressure, measure your belly, and listen to your baby's heartbeat. As you enter the third trimester of pregnancy, it's important to continue taking care of yourself and your growing baby. This means eating a healthy, balanced diet, staying hydrated, and getting regular exercise. Walking, swimming, and prenatal yoga are great options for staying active during pregnancy. It's also important to prepare for your baby's arrival. Start thinking about your birth plan and what kind of experience you want. Consider taking a childbirth education class, which can help you feel more prepared and confident about labor and delivery. In addition to preparing for the birth, you'll want to start thinking about what you'll need for your baby's arrival. This includes things like a car seat, crib, diapers, and clothing. Overall, the 29-week of pregnancy is an exciting time as your baby continues to grow and develop. As always, if you have any concerns or questions, don't hesitate to reach out to your healthcare provider. Thank you for tuning in, and we'll see you next time for another update on your pregnancy journey. Hello and welcome to this video about 30 weeks of pregnancy and baby development. This is an exciting time for both the mother and baby as there are many changes happening. In this video, we will discuss the baby's development, the mother's physical changes, and how to take care of yourself during this period. Baby development. At 30 weeks of pregnancy, the baby is about the size of a cucumber and weighs around 3 pounds. Here are some key developments happening at this stage. Brain development. The baby's brain is growing rapidly, and the cerebral cortex is developing, which is responsible for controlling movement, sensation, and perception. Lung development. The lungs are almost fully developed, and the baby is practicing breathing movements, which will help them breathe on their own after birth. Fat deposits. The baby is accumulating fat deposits under the skin, which will help regulate their body temperature and provide energy after birth. Sensory development. The baby's senses are becoming more refined, and they can recognize sounds, light, and even taste. Movement. The baby is quite active and can move around, kick, and even hiccup. You may feel their movements quite strongly at this stage. Mother's physical changes. As the baby grows, the mother's body will also go through many changes. Here are some of the most common physical changes at 30 weeks. Weight gain. Most women will have gained around 20 to 25 pounds by this stage of pregnancy. The weight gain is essential for the baby's growth and development. Braxton Hicks contractions. These are mild contractions that may be felt in the uterus. They are not usually painful and are a sign that the uterus is preparing for labor. Stretch marks. The skin around the abdomen may begin to stretch, causing stretch marks. These usually fade after pregnancy. Fatigue. As the baby grows, the mother may feel more tired and require more rest. Shortness of breath. The growing baby can put pressure on the diaphragm, making it harder to breathe deeply. Taking care of yourself. It's essential to take care of yourself during pregnancy to ensure both you and your baby stay healthy. Here are some tips for staying healthy during the 30th week of pregnancy. Eat a healthy diet. Make sure you are eating a balanced diet that includes plenty of fruits, vegetables, and lean protein. Avoid foods that are high in sugar or fat. Stay active. Regular exercise can help you feel better and reduce stress. Walking, swimming, and prenatal yoga are all good options. Conclusion. At 30 weeks of pregnancy, the baby is growing rapidly, and the mother's body is going through many changes. It's essential to take care of yourself and attend regular prenatal checkups to ensure both you and your baby stay healthy. Remember to eat a healthy diet, stay active, get plenty of rest, and drink plenty of water. Thank you for watching, and we wish you a healthy and happy pregnancy. Hello and welcome back to our series on pregnancy. Today, we will be discussing week 31 of pregnancy and everything you need to know about your baby's development and your symptoms. So, let's get started. Baby development. At week 31, your baby is approximately 16 inches long and weighs around 3.5 pounds. Here are some of the key developments happening to your baby during this time. Rapid brain growth. Your baby's brain is growing rapidly during this time, which means that they will be able to process information more efficiently. Lung development. Your baby's lungs are almost fully developed at this point, and they are practicing their breathing movements. Sleep cycles. Your baby is now starting to have regular sleep and wake cycles. Baby fat. Your baby is putting on more baby fat, which helps regulate their body temperature after birth. Symptoms. As you enter the final trimester of your pregnancy, you may experience some new symptoms or the worsening of old ones. Here are some of the common symptoms that you may experience at week 31. Braxton Hicks contractions. You may start to experience Braxton Hicks contractions, which are mild contractions that help prepare your body for labor. Shortness of breath. As your uterus grows and pushes against your diaphragm, you may experience shortness of breath. Back pain. As your baby grows, the weight can put pressure on your back, causing discomfort. Swelling. You may experience swelling in your feet, ankles, and hands due to the increased fluid in your body. Heartburn. As your uterus grows, it can put pressure on your stomach, causing acid reflux and heartburn. Fatigue. As your body works hard to support your growing baby, you may feel more tired than usual. Frequent urination. Your baby's position may put pressure on your bladder, causing you to urinate more frequently. Tips for a healthy pregnancy. Eat a healthy diet. Make sure to eat a well-balanced diet that includes plenty of fruits, vegetables, whole grains, and lean proteins. Stay hydrated. Drink plenty of water and other fluids throughout the day to stay hydrated. Exercise. Gentle exercise, such as walking or swimming, can help relieve some of your pregnancy symptoms and prepare your body for labor. Attend prenatal appointments. Regular prenatal appointments with your healthcare provider are essential to monitor your baby's growth and ensure a healthy pregnancy. Take childbirth classes. Childbirth classes can help prepare you and your partner for labor and delivery. Conclusion. At week 31 of pregnancy, your baby is continuing to grow and develop rapidly. You may experience some new symptoms or the worsening of old ones, but there are steps you can take to stay healthy and comfortable during this time. Remember to eat a healthy diet, stay hydrated, exercise, get plenty of rest, attend prenatal appointments, take childbirth classes, and practice relaxation techniques. With these tips, you can have a healthy and happy pregnancy. Thanks for tuning in, and we'll see you next time. Hello everyone, welcome to my YouTube channel. Today we will be discussing 32 weeks pregnancy and baby development, symptoms, tips, and healthcare. As a senior gynecologist, I have had years of experience helping women through their pregnancy journey. So, without further ado, let's get started. Baby development. At 32 weeks, your baby is about the size of a large jicama, measuring around 16.7 inches long and weighing about 4 pounds. Your baby's eyes are now fully formed and can open and close them. The bones in your baby's skull are not yet fused, which allows for easier passage through the birth canal during delivery. Your baby's immune system is starting to develop, and they are producing white blood cells to help fight off infections. Your baby's lungs are also continuing to develop and produce surfactant, a substance that helps keep the air sacs in the lungs from sticking together. Symptoms. At 32 weeks, you may experience increased back pain and discomfort as your baby continues to grow and put pressure on your back and pelvis. You may also experience increased fatigue and difficulty sleeping due to the physical strain of pregnancy. Braxton Hicks contractions, or practice contractions, may become more frequent as your body prepares for labor. Heartburn and indigestion may also become more common as your baby continues to push up on your stomach. Swelling in your feet and ankles may become more pronounced as your body retains more fluids. Tips. To help alleviate back pain, try using a pregnancy pillow to support your belly and lower back while sleeping. Practice good posture and avoid standing or sitting in the same position for too long to help prevent back pain and swelling. Stay hydrated and try to keep your feet elevated as much as possible to reduce swelling. To help manage heartburn and indigestion, try eating smaller, more frequent meals and avoid foods that trigger symptoms. Make sure to stay active and get regular exercise, such as walking or prenatal yoga, to help maintain your overall health and prepare your body for labor. Healthcare. At 32 weeks, you will typically have a prenatal visit with your healthcare provider to check on your baby's growth and development. Your healthcare provider may also perform a Group B streptococcus (GBS) test to check for the presence of bacteria that can be harmful to your baby during delivery. It is important to continue taking any prescribed prenatal vitamins and medications as directed by your healthcare provider. In conclusion, 32 weeks is an important milestone in your pregnancy journey. Your baby is continuing to develop and grow, and you may experience new symptoms and challenges. Remember to practice good self-care, stay active, and attend all scheduled prenatal appointments to ensure a healthy pregnancy and delivery. Thank you for watching, and I'll see you in the next video. Hello everyone. Today, we will talk about the 33 week of pregnancy and the development of the baby at this stage. We will also discuss some common symptoms that mothers experience during this period and tips for taking care of their health. Baby development. At 33 weeks, the baby is about 17 inches long and weighs around 4 pounds. The baby's lungs are still developing and producing surfactant, a substance that helps the lungs expand and contract properly after birth. The baby's brain is rapidly developing, and they can now sense light and dark. The baby's bones are hardening, and they are gaining more fat under their skin, which will help regulate their body temperature after birth. The baby's movements are becoming more coordinated, and they can respond to sound. Symptoms. Braxton Hicks contractions. These are practice contractions that help prepare the uterus for labor. They can be uncomfortable, but are usually not painful. Backaches. As the uterus expands, it puts pressure on the lower back, causing discomfort. Shortness of breath. The growing uterus can also put pressure on the diaphragm, making it harder to breathe. Fatigue. As the body works harder to support the growing baby, mothers may feel more tired than usual. Swelling. The body retains more water during pregnancy, causing swelling in the feet, ankles, and hands. Tips for health care. Continue to eat a healthy and balanced diet, including plenty of fruits, vegetables, and protein. Stay hydrated by drinking plenty of water and avoiding sugary or caffeinated beverages. Exercise regularly, but avoid strenuous activities that could put too much strain on the body. Sleep on your side, preferably the left side, to improve blood flow to the baby and reduce the risk of stillbirth. Attend all prenatal appointments and communicate any concerns with your healthcare provider. Preparing for birth. Start thinking about a birth plan, including preferences for pain management and delivery options. Consider taking childbirth classes to learn about the labor process and techniques for coping with pain. Pack a hospital bag with essentials for both mother and baby, including clothing, toiletries, and a car seat. Talk to your healthcare provider about the signs of labor and when to call or go to the hospital. Conclusion. As you approach the end of your pregnancy journey, it is important to take care of yourself and your growing baby. Remember to listen to your body, attend all prenatal appointments, and communicate any concerns with your healthcare provider. By taking these steps, you can help ensure a healthy and safe delivery for both you and your baby. Thank you for watching, and I wish you all the best in your pregnancy journey. Hello everyone, we are going to discuss pregnancy at 34 weeks. At this stage, your baby is approximately 18 inches long and weighs around 4.5 pounds. Your baby's organs are fully developed, and they are continuing to gain weight and grow. Braxton Hicks contractions. These are practice contractions that your body goes through as it prepares for labor. They can be uncomfortable, but are usually not painful. Shortness of breath. As your baby continues to grow, it can push against your diaphragm and make it harder to breathe. You may notice that you need to take more frequent breaks or rest periods. Pelvic pain. As your baby moves into the birth canal, you may experience discomfort or pain in your pelvic area. Swelling. Many women experience swelling in their feet and ankles during pregnancy. Make sure to elevate your feet when possible and stay hydrated. Gestational diabetes. This is a type of diabetes that develops during pregnancy. If you are diagnosed with gestational diabetes, your doctor may recommend a special diet and monitoring your blood sugar levels. Preeclampsia. This is a potentially serious condition that can develop during pregnancy, characterized by high blood pressure and protein in the urine. If you experience symptoms like severe headaches, vision changes, or abdominal pain, contact your doctor immediately. Fetal movement. You should continue to monitor your baby's movements and contact your doctor if you notice any significant changes. Now, let's talk about some tips for taking care of yourself during this stage of pregnancy. Rest. As your due date approaches, make sure to get plenty of rest and sleep. This will help you conserve your energy for labor and delivery. Stay hydrated. Drink plenty of water and avoid sugary or caffeinated drinks. Exercise. Gentle exercise like walking or prenatal yoga can help you stay healthy and prepare your body for labor. Kegel exercises. These exercises can help strengthen your pelvic floor muscles and prepare your body for childbirth. Prenatal classes. Consider taking a prenatal class to learn more about childbirth, breastfeeding, and newborn care. Pack your hospital bag. Start packing your hospital bag with essentials like clothes for you and your baby, toiletries, and important documents. Talk to your doctor. Make sure to keep your doctor updated on any symptoms or concerns you may have. Finally, let's talk about your baby's development at 34 weeks. Baby's lungs. Your baby's lungs are almost fully developed, and they are practicing breathing movements in preparation for birth. Body fat. Your baby is continuing to gain weight and develop body fat, which will help regulate their body temperature after birth. Sleep and wake cycles. Your baby may start to have regular sleep and wake cycles, which can help prepare them for life outside the womb. Head down position. Most babies will move into the head down position in preparation for delivery. Overall, pregnancy at 34 weeks is an exciting and important time as you prepare for the birth of your baby. Remember to take care of yourself and stay in touch with your doctor as you get closer to your due date. Thanks for watching, and I'll see you in the next video. "35 weeks pregnancy. Baby development and symptoms." Welcome back to our channel, where we explore the incredible journey of pregnancy. Today, we're going to dive into the exciting world of 35 weeks of pregnancy. At this stage, your baby is rapidly developing, and you may be experiencing various symptoms. So let's get started. Baby's development. Your baby now weighs around 5.5 to 6 pounds and measures about 18 inches from head to toe. The baby's organs and systems are nearly fully developed, and the lungs continue to mature. The skin is becoming smoother as the fat layers continue to fill out. Your baby's brain is rapidly growing, and the nervous system is maturing. The baby's bones are fully formed but are still flexible to ease the birthing process. Symptoms you may experience. Braxton Hicks contractions. You may experience more frequent and intense practice contractions, which can help prepare your body for labor. Shortness of breath. As your uterus expands, it pushes against your diaphragm, making it harder to take deep breaths. Increased vaginal discharge. It's common to have a thicker and heavier discharge at this stage, but consult your doctor if it's accompanied by itching, burning, or a foul odor. Pelvic discomfort. The growing baby puts pressure on your pelvis, leading to pelvic pain or discomfort. Frequent urination. The baby's position and size may put pressure on your bladder, causing the need to urinate more often. Trouble sleeping. Finding a comfortable position becomes more challenging, and you may experience pregnancy-induced insomnia. Heartburn and indigestion. Hormonal changes and the baby's position can lead to increased acidity and digestive issues. Self-care tips for this stage. Rest and sleep. Listen to your body and prioritize getting enough rest and sleep. Exercise. Engage in gentle exercises like walking or prenatal yoga to stay active and relieve discomfort. Pelvic floor exercises. Strengthen your pelvic floor muscles by practicing Kegel exercises. Maintain a healthy diet. Focus on well-balanced meals that include fruits, vegetables, lean proteins, and whole grains. Stay hydrated. Drink plenty of water throughout the day to prevent dehydration and assist with digestion. Use proper body support. Invest in a maternity support belt or pillow to help alleviate back and pelvic pain. Practice relaxation techniques. Deep breathing exercises, meditation, or prenatal massages can help reduce stress and promote relaxation. Prepare for breastfeeding. Attend breastfeeding classes, educate yourself about proper latch techniques, and gather essential supplies. And that wraps up our exploration of 35 weeks of pregnancy. Remember, every pregnancy is unique, and if you have any concerns or questions, consult your healthcare provider. Stay tuned for more exciting updates on the journey of pregnancy. Don't forget to like, subscribe, and hit that notification bell to never miss an episode. Take care, and we'll see you next time. Greetings, and welcome back to our Pregnancy Journey series. Today, we're diving into the incredible journey of the 36th week of pregnancy. As your due date gets closer, both you and your baby are experiencing some remarkable changes. Let's explore the symptoms you may encounter and the exciting developments happening to your little one. Maternal symptoms at 36 weeks. Increased discomfort. Your baby's growth puts additional pressure on your abdomen, causing discomfort and backaches. Frequent urination may persist as your baby continues to press on your bladder. Shortness of breath can occur due to limited space for your lungs. Braxton Hicks contractions. These contractions, also known as practice contractions, become more noticeable and frequent. They help prepare your body for labor, but they are usually irregular and mild. Swollen feet and ankles. Fluid retention can cause swelling in your feet and ankles. Elevating your legs and wearing comfortable shoes can help alleviate this symptom. Nesting instinct. Many women experience a strong urge to prepare their homes for the baby's arrival. This may involve cleaning, organizing, and setting up the nursery. Insomnia and fatigue. Discomfort, frequent bathroom trips, and hormonal changes can disrupt your sleep. Take short naps, practice relaxation techniques, and maintain a consistent sleep routine. Baby development at 36 weeks. Size and weight. Your baby is approximately 18 inches long and weighs around 6 pounds. Although still growing, they are almost fully developed. Fetal position. Most babies settle into the head-down position, preparing for birth. The head engages into the pelvis, which is a sign that labor might be approaching. Lung development. By 36 weeks, your baby's lungs have matured significantly. They continue to produce surfactant, a substance that helps the lungs expand and function properly after birth. Immune system. Your baby's immune system strengthens as they receive antibodies from you through the placenta. This provides them with some protection against infections early in life. Brain and nervous system. The brain development is almost complete, with rapid growth in the cerebral cortex. Your baby's nervous system is fully functional, and they can process information and regulate body temperature. Baby's movement. Due to limited space, you may feel more rolling and stretching movements instead of kicks. Hiccups are common as your baby practices swallowing and inhaling amniotic fluid. Preparations for the upcoming weeks. Finalize birth plan. Discuss your birth preferences with your healthcare provider and ensure they are included in your birth plan. Pack your hospital bag. As your due date nears, have a bag ready with essentials for you and your baby. Include comfortable clothing, toiletries, nursing bras, baby clothes, diapers, and important documents. Attend childbirth classes. Join childbirth education classes to learn about labor, pain management, and relaxation techniques. Discuss breastfeeding. Talk to your healthcare provider or a lactation consultant about breastfeeding techniques and potential challenges. Hello and welcome back to our pregnancy journey. Today, we're diving into the incredible journey of week 37 of pregnancy. As we approach the final stretch, both you and your baby are going through significant changes. So, let us explore the symptoms and developments you can expect during this exciting time. But before we begin, don't forget to hit that subscribe button and ring the notification bell, so you don't miss any of our future videos. Week 37 marks the beginning of the 9th month of pregnancy, and your baby is almost ready to make their grand entrance into the world. Let us start by taking a look at the baby's development. At this stage, your baby weighs around 6.5 pounds 2.9 kilograms and measures approximately 19 inches 48 centimeters long. They are fully developed and are fine-tuning their systems for life outside the womb. Their organs, including the lungs, digestive system, and immune system, are all working in unison, preparing for the transition. Now, let us discuss the symptoms and changes you may experience during week 37. Increased pressure and discomfort. Host, as your baby continues to grow, you may experience increased pressure and discomfort in your pelvic region. This happens as your baby's head descends into the pelvis, preparing for birth. This can lead to a frequent need to urinate, difficulty walking, and even back pain. Braxton Hicks contractions. Host, you may also notice an increase in Braxton Hicks contractions, which are practice contractions that help prepare your body for labor. These contractions are usually irregular and less painful than true labor contractions. Remember to stay hydrated and practice relaxation techniques to ease any discomfort. Fatigue and difficulty sleeping. Host, fatigue and difficulty sleeping can become more prominent during week 37. Your growing belly, frequent bathroom trips, and discomfort can make it challenging to find a comfortable position. Try using pillows for support and establishing a relaxing bedtime routine to improve your sleep. Increased vaginal discharge. Host, during this stage, you might notice an increase in vaginal discharge. This discharge, known as leukorrhea, helps prevent infections. However, if you experience any changes in color, consistency, or a foul odor, it's essential to consult your healthcare provider. Swelling and varicose veins. Host, swelling, especially in the feet and ankles, can become more pronounced at this stage of pregnancy. Additionally, you might notice the appearance of varicose veins due to increased blood volume and pressure. Elevating your legs, wearing compression stockings, and taking regular walks can help alleviate these symptoms. Emotional changes. Host, lastly, as your due date approaches, you might experience a mix of emotions, including excitement, nervousness, and even anxiety. It's essential to surround yourself with a support system and communicate your feelings with your loved ones. And that wraps up our journey through week 37 of pregnancy. It's amazing to see how far both you and your baby have come. Remember, each pregnancy is unique, so if you have any concerns or questions, don't hesitate to reach out to your healthcare provider. Stay tuned for our next video, where we'll discuss the final stages of pregnancy and the upcoming labor and delivery. Don't forget to like this video and leave a comment below if you found this information helpful. Until next time, take care and enjoy the remaining weeks of your pregnancy journey. Thank you for watching, and we'll see you soon. Hello, and welcome back to our YouTube channel, where we discuss all things pregnancy and baby related. Today, we're diving into the fascinating world of 38 weeks of pregnancy. So, let us get started. Baby's size and weight. At 38 weeks, your baby is approximately the size of a pumpkin, measuring around 19 to 21 inches 48 to 53 centimeters and weighing about 6 to 7 pounds 2.7 to 3.2 kilograms. Your little one has been growing and developing rapidly throughout the pregnancy journey. Organ development. By this stage, your baby's organs, including the lungs, digestive system, and immune system, are almost fully developed. These organs have been maturing over the past several weeks, preparing your baby for life outside the womb. Baby's position. Most babies settle into a head-down position in the uterus by 38 weeks. This is known as the vertex or cephalic presentation, which is the ideal position for a vaginal delivery. However, if your baby is not in the head-down position, your healthcare provider may discuss options for encouraging the baby to turn. Braxton Hicks contractions. You may be experiencing Braxton Hicks contractions more frequently now. These practice contractions feel like a tightening of the abdomen and are a way for your body to prepare for labor. If the contractions become regular, intense, or are accompanied by other signs of labor, it's important to contact your healthcare provider. Pelvic discomfort. At this stage, you may experience increased pelvic pressure and discomfort. Your baby's fatigue and difficulty sleeping. As your belly grows bigger, it can become challenging to find a comfortable sleeping position. You may also experience frequent bathroom trips during the night. Combined with anticipation and hormonal changes, this can lead to fatigue. It's important to rest as much as possible and practice relaxation techniques. Nesting instinct. Many expectant mothers experience a surge in energy and the desire to prepare their home for the baby during the final weeks of pregnancy. This is often referred to as the nesting instinct. It's a natural urge to clean, organize, and make sure everything is ready for the arrival of your little one. Emotional changes. With the due date approaching, it's common to feel a mix of excitement, anxiety, and a range of other emotions. The hormonal fluctuations can contribute to mood swings as well. Remember to communicate with your partner and support system, and don't hesitate to seek professional help if you're feeling overwhelmed. Hospital bag and birth plan. Now is the time to make sure your hospital bag is packed and ready to go. Include essentials like comfortable clothes, toiletries, and items for the baby. It's also a good idea to have your birth plan written out and discuss it with your healthcare provider. However, keep in mind that labor and delivery can be unpredictable, so be flexible with your expectations. That wraps up our discussion on the development and symptoms during 38 weeks of pregnancy. We hope you found this information helpful and informative. Don't forget to subscribe to our channel for more pregnancy and baby-related content. As always, take care of yourself and your little one. See you next time. Welcome to our YouTube channel, where today, we'll take you on a fascinating journey through the 39 weeks of pregnancy and baby development. From the magical moment of conception to the incredible birth of a new life, we'll explore the various stages, milestones, and changes that occur during this remarkable process. So, let us dive right in. Week 1 Conception. Host. In Week 1, conception occurs when a sperm fertilizes an egg, forming a zygote. This tiny cluster of cells begins its journey towards the uterus. Week 2 Implantation. Host. By Week 2, the zygote implants itself into the uterine lining, where it will receive nourishment and continue its rapid division and growth. Week 3 Embryonic Development. Host. During Week 3, the zygote becomes an embryo, and its cells start differentiating into the brain, spinal cord, and other essential structures. Week 4 Heartbeat. Host. In the 4th week, the heart starts to beat, and the embryo begins to take on a recognizable shape. It's about the size of a poppy seed at this stage. Week 5 Nervous System. Host. By Week 5, the nervous system starts developing, and limb buds appear, which will eventually grow into arms and legs. Week 6 Facial Features. Host. In Week 6, the embryo's facial features, such as eyes, ears, and a mouth, begin to form. Week 7 Organ Development. Host. Week 7 marks the beginning of organ development, with the brain, lungs, liver, and kidneys all starting to take shape. Week 8 Fetal Stage. Host. At Week 8, the embryo officially becomes a fetus. It's about the size of a raspberry and can start moving its limbs. Week 9-12 Rapid Growth. Host. During weeks 9 to 12, the fetus undergoes rapid growth. Its sex organs start to form, and it can make small movements, though the mother cannot feel them yet. Week 13 Trimester 1 ends. Host. At Week 13, the first trimester comes to an end. The fetus is now about the size of a lemon, and its tiny fingerprints are forming. Week 14-16 Developing Senses. Host. In weeks 14 to 16, the fetus's senses begin to develop. It can now hear sounds from the outside world and may even suck its thumb. Week 17-20 Movement Sensation. Host. During weeks 17 to 20, the mother starts to feel the baby's movements. The fetus's skin becomes covered with vernix, a protective waxy substance. Week 21-24 Viability. Host. At weeks 21 to 24, the fetus reaches the age of viability, where it has a chance of survival outside the womb with medical assistance. Week 25-28 Rapid Brain Development, Host. During weeks 25 to 28, the baby's brain undergoes significant development. The eyes open and close, and the fetus has distinct sleep-wake cycles. Week 29-32 Developing Immune System, Host. In weeks 29 to 32, the baby's immune system strengthens as it receives antibodies from the mother. Week 33-36 Lung Development, Host. At weeks 33 to 36, the baby's lungs mature, and it assumes a head-down position in preparation for birth. Week 37 Full Term, Host. Congratulations! At week 37, the baby is considered full term, and it's now ready to be born. Week 38-39 Final Weeks, Host. In the final weeks, the baby drops lower into the pelvis, relieving pressure on the mother's diaphragm and making breathing easier. Birth, Host. And now, after an incredible journey of 39 weeks, it's time for the most momentous event, the birth of the baby. It's a miraculous and emotional experience that marks the beginning of a new chapter in the lives of both the parents and the newborn. Conclusion, Host. Pregnancy and baby development encompass an awe-inspiring process that showcases the wonders of life. From a single cell to a fully formed human being, these 39 weeks are filled with incredible growth, milestones, and changes. We hope you enjoyed this journey with us today. Outro, Host. If you found this video informative and fascinating, don't forget to like and share it with others who might be interested. Subscribe to our channel for more captivating content on parenting, health, and lifestyle. Thanks for watching, and we'll see you in the next video.
Title: 40 Weeks of Pregnancy, Symptoms, and Baby Development. Introduction: Welcome to our comprehensive guide on the incredible journey of pregnancy, spanning 40 weeks of symptoms and baby development. Weeks 1-4. Week 1, conception occurs, and the journey begins. Week 2, the fertilized egg travels down the fallopian tube. Week 3, implantation takes place, and the embryo starts to form. Week 4, the embryo develops the neural tube, which will become the brain and spinal cord. Weeks 5 to 8. Week 5, the heart begins to beat, and limb buds form. Week 6, facial features and the heart's chambers start to develop. Week 7, baby's arms and legs grow longer, and facial features become more defined. Week 8, the embryo is now called a fetus, and organs continue to form. Weeks 9 to 12. Week 9, fingers and toes start to develop, and the fetus can make spontaneous movements. Week 10, the baby's facial expressions begin, and the vital organs are functioning. Week 11, the fetus is about the size of a lime, and gender can be determined. Week 12, baby's reflexes develop, and the risk of miscarriage decreases significantly. Weeks 13 to 16. Week 13, baby's vocal cords begin to form, and the digestive system develops. Week 14, facial features become more distinct, and the baby can now squint and frown. Week 15, the baby starts producing urine and the skin becomes more transparent. Week 16, baby's movements become more coordinated and the bones harden. Week 17-20, week 17, the fetus can hear external sounds and the umbilical cord thickens. Week 18, baby's taste buds form and the nervous system continues to mature. Week 19, vernix caseosa, a protective layer, covers the skin. Week 20, halfway there, the baby can suck its thumb, and the mother may feel the first movements. Weeks 21-24. Week 21, eyebrows and eyelashes develop, and the baby can taste the amniotic fluid. Week 22, the fetus is now responsive to light and dark. Week 23, rapid brain growth occurs, and lungs continue to develop. Week 24, the baby's viability outside the womb increases, though it's still premature. Weeks 25-28. Week 25. Baby's kicks become stronger, and lungs are maturing further. Week 26. Eyes open, and the baby responds to external stimuli. Week 27. Rapid weight gain begins, and the nervous system is fine-tuning. Week 28. The third trimester begins, and the baby's survival chances significantly improve. Weeks 29-32. Week 29. The baby's bones fully harden, and the kicks and movements may be visible. Week 30. Lungs are almost fully developed, and the baby practices breathing. Week 31. The baby's immune system strengthens. Week 32. Baby's toenails and fingernails grow, and the head settles into the pelvis. Weeks 33-36. Week 33. The baby's bones are fully formed, and the nervous system is maturing. Week 34. The baby practices blinking, and the amniotic fluid decreases as the baby grows. Week 35. The baby's liver and kidneys are fully functional. Week 36. The baby is gaining weight rapidly, preparing for birth. Weeks 37-40. Week 37. Full term. The baby's organs are ready for life outside the womb. Week 38. The baby's immune system gets a boost from the mother. Week 39-40. The baby may arrive any time now. The mother might experience signs of labor, and it's time to prepare for the exciting moment of birth. Conclusion. As the 40-week journey concludes, we celebrate the incredible process of pregnancy, from conception to the miraculous moment of welcoming a new life into the world. Stay tuned for more parenting tips and guidance on our channel. The effects of teenage pregnancy, 20 key points. 1. Introduction. Hello everyone, welcome back to our channel. Today, we're diving into a crucial topic, the effects of teenage pregnancy. 2. Higher health risks. Teenage mothers often face higher health risks during pregnancy compared to older women. 3. Educational challenges. Teen moms are more likely to drop out of school, limiting their educational and career opportunities. 4. Economic impact. Teenage pregnancy can contribute to financial strain on families and communities. 5. Emotional stress. Young parents may experience heightened emotional stress due to the challenges of parenthood at an early age. 6. Impact on mental health. Teenage mothers are at a higher risk of experiencing mental health issues such as depression and anxiety. 7. Social stigma. Teen moms often face social stigma and judgment from peers and the community. 8. Parenting skills. Being a parent requires skills that young individuals might not have fully developed, impacting effective parenting. 9. Relationship strain. Teenage pregnancies can strain relationships, leading to higher rates of breakups. 10. Limited social life. Young parents may find it challenging to maintain an active social life due to parenting responsibilities. 11. Child development. Children born to teenage parents may face developmental challenges. 12. Single parenthood. Teenage pregnancies often lead to single parenthood, which can be challenging for both the parent and child. 13. Healthcare access. Access to